Y'all, welcome back to the channel. Every time y'all see me, I'm going through some type of, I'm really gonna have to get me some what you call divine help, honey. But anyway, welcome back to the channel. I am Lady Nyca, and with my this week edition of In the News and Shit. This one gonna be a little bit different, guys, because I'm going to incorporate a subject that that's near and dear to me, because it's my battle every day. As you all know, or those who don't know, May is Lupus Awareness Month, and I have, due to my own personal setbacks, I haven't come on and said anything about it. I was supposed to speak at a convention next weekend in Baton Rouge on lupus awareness, but due to illness a couple of weeks ago, I'm not going to push myself to make that trip or to put that much on me right now with all the stuff that I got going on. Okay, I was unable to do the walk this month, which really saddened me, because if nothing else, I try to make sure I'm involved in that walk every year to arise lupus awareness, and also to garner support for the lupus organization, lupus.org. Monies for further research to hopefully one day conquer this terrible disease. Now, for those of you who don't, I had made me a couple of 2-3 notes to y'all, because I don't want to leave nothing out. It's my story, so it's easy for me to leave parts out because of the fact that I live it, and so I don't really just talk about it a whole lot. But for those of y'all that don't know, lupus it's an autoimmune disease. The antibodies that all of our bodies build up to fight off illnesses and infections. Well, people with lupus, our bodies build that antibody up at 1,000% times greater than what the normal person would do it. Okay. Because of that, the immune system then attacks its own tissues. And, it's different in each person, okay? But that's what it is. It affects 1 in 2,000 people. And 9 out of 10 lupus cases occur in women, okay? It occurs in all races and ethnic groups, but it's more frequent in the African American community, okay? Everybody everybody's symptoms are not gonna be the same. I could be sitting next to a person with lupus, and they have one set of symptoms, and I have the same core disease, but I have my own set of symptoms and things that I go through. Everybody lupus ain't the same, is what I'm saying. And I think it's like 3 or 4 different types of lupus, and we're going to talk about them, okay? Because I want to kind of explain it a little bit to let you all know exactly what the disease is. Now, the first type is the type I have. Mine is called SLE. SLE is short for systemic lupus erythematosus. I had it for over 13 years now, so I'm kind of good with these terminologies and stuff like that. And basically, it's chronic inflammation. Okay, it's especially in the kidneys, the joint, and the skin. It's very, you can recognize it really good if you know anything about it, because it has a identifying mark that all lupus people usually get, and that's that butterfly rash that'll occur right along here. Mine, over the course of years, have they kind of I use a lot of different stuff for my skin, like cocoa butter, aloe vera, and stuff like that. That worked for me. I was able to, over the years, put that on daily several times throughout the day, so it's not as pronounced as it once was. At one time, it was like completely dark from right along here, like the outstretch of a butterfly. That's how it was. It was really, really dark, and I'm dark skinned, as you can see, but this was chocolatey, y'all. I'm talking about, it was really dark, and no matter how much foundation back then you would try to use it, you really never could tone it out to where people wouldn't be able to see it. Now, from a distance, it don't look like nothing wrong, but if I get closer, you can see the issues that I have, okay? It affects the cardiovascular and the nervous system. You know, they can be affected too. In my case, of course, you see that it has. Now, I already had a genetic minus on me because my mother had heart issues. That, along with the fact that the lupus traits started on my father's side, they combined, which caused me to have really bad cardiovascular issues. You know, I have a 70% block in one of the main arteries leading to my heart, which is why this last heart attack was so hard. And, you know, they told my ass that, you know, it's a choice now, child, and we're going to talk about that choice later on. The next one is CCLE, and that's chronic cutaneous lupus erythematosus. Now, that one, you don't have to have SLE to get this either, you know. That one is, let me see. It's limited, of course, to the skin, but it does have other symptoms and stuff. I'm not really abreast on this one because I don't even know some people that got this form of it, but you know, I've heard of it before, and I tried to do a little research so I would be able to come on and kind of explain it. Now, according to the research, it says study shows 5% or more of people with, you know, this form of lupus does develop the SLE, which is what I have, which is the chronic inflammation of the joints, the what else I go through? I've had my kidneys. I've had a biopsy on my kidneys 2 or 3 times, I think. You know, I have, you know, like I said, inflammation of the joints, really, really bad. And then I do have skin issues, like the lesions that break out and stuff like that. And I also suffer hair loss from time to time too. I mean, you can't tell always, but yeah, it's crucial sometimes. Yeah. Now, certain drugs can cause lupus-like symptoms in people who do not have SLE, okay? And it's usually temporary and subsides within months of the time that, you know, the drugs are stopped, okay? Those are the people that have, they had a limited lupus, you know, they don't have it that long, child. That's what I'm trying to tell y'all. Then it's the neonatal lupus erythematosus. Now that occur. Now a woman can be completely healthy, but she has these antibodies. One is like the anti-Rho gene, anti-LA. It's a its initials. I think it's RPN. But 1 in 1,000 perfectly healthy women carry that gene in them anyway. And those are the ones that are most susceptible to having, you know, babies that have the lupus symptoms. And most of the time with those kids, it's contained to their skin. And studies have shown that if you have neonatal lupus, your baby does, this will subside in time with or without a treatment. It's contained to their skin. You know, they may have like lesions and shit like that, but it'll clear up and it'll go away on its own. You know, most of these kids, they grow up to be relatively healthy. Now sometimes they do have, you know, a congenital heart block, but what doctors usually do if your baby's born with this condition is they'll do a pacemaker, and over time those kids, as they grow up, they lead, you know, they lead normal lives. I met a couple of these kind, okay? And the next one is childhood lupus, okay? It affects the body the same way it affects it in an adult body. They have the same problems, and most of the times is kidney issues and things like that. And believe it or not, you know, boys are more likely to get childhood lupus than men are to get adult lupus, because, you know, men can't get this shit. It can be treated. It can be treated. Most of the times the doctors are kind of scared to deal with it because, like I say, it's childhood lupus in kids, but it's aggressive like lupus in an adult, such as myself, okay? And what they do is doctors have to really watch them. It's an aggressive therapy set, you know, set of medicines that they're going to use to help you do better. Sometimes it go away, sometimes it don't, okay? But they do aggressive shit to them little kids. Sometimes they be like 13 years old, and what they have to do is they got to be mindful of how much the medication that they do provide for those kids that's going through that. Because some of the medications, if you use them for a long period of time, with some kids don't come out of childhood lupus until they hit their early 20s, really. But, you know, you have to be careful because For one, they're using prednisone, and that's a steroid, and that's not good in anybody that's, for any long period of time. Anyway, you don't need that shit on you like that. But I'm gonna put a link in the description box where I get some of my information. Some of this stuff, y'all, I've learned through education from John Hopkins Lupus Center. They've helped me a whole lot. I've talked to people, I've talked to people over at the center and stuff, called them and stuff, and had questions, and they've sent me literature and all kinds of things about it. So, because I wanted to, lupus was so, it was a silent disease, it's been around for a long time, but people never really had a name for it. And then as it became known, it's not many drugs on the market. They are now developing a whole lot of different drugs and stuff. That's why I implore people to please, if you can donate, help out in the cause. It's serious. I don't equate one disease to the next. I just feel like if we gonna, everybody can be affected by, anybody can be affected by lupus in some kind of way, but it used to didn't be that many drugs on the market when I first got my diagnosis, and I got my diagnosis when I was in my 30s. I think my early. It actually, if I date back, now that I understand the disease so much better, I recall that, it was my late 20s when the first symptoms started coming, and that was a lot of fatigue and stuff. Okay, and then the next one became, I started having hair loss. But it wasn't bad yet. And over the years, it would die off, Like, I'll say, I had my son when I was 25, my last child, 24, 25. By 26, I was starting to have symptoms, like the extra fatigue and the hair loss and the irritability. I was having that a whole lot. By 27, 28, it started dying off. So that's why it's a silent thing. It's certain tests that you have to, if you're not looking for lupus, it can manifest in your body for years. And I found that out because, like I said, I go all the way back. Now that I understand the disease and how it works, I can go all the way back to at least 26 years old that I was going through this. But I don't think I got my diagnosis until I was like 29 or 30. I can't remember, guys. You know how it is. Shit come and go sometimes. But yeah, it wasn't that many drugs. And just because it's a lupus drug does not mean that it's going to work for you. Okay? Most lupus patients will tell you that they tried a series of drugs before they found the right mix. It's kind of like making a cake, y'all. You put this into it and that into it and that into it, to try to see if this cake is going to rise and taste and maintain moisture the way you want it to. If it don't, then you back to the drawing board. You got to add more ingredients until you finally find that special batch that works for you, that gives you that more succulent cake that you want. That's the same way it is with lupus medications, because it's not that many of them out there that specialize in just lupus issues alone. It's good. They help with the lupus issues, but it's mostly, a drug that may be used for something like rheumatoid arthritis or something like that, okay? So over the years, it was I went from the first time when I first got diagnosed and saw my rheumatologist and stuff, I think I was on like 17 pills a day. It was killing my ass too, y'all. But over the time, we saw I ain't need this drug. Then we saw I didn't need that drug, so the amount decreased. And it does that now, even though I'm so many years into this disease, I still have times where if something starts to flare up, or it's something goes wrong, or some of my levels, like with my kidneys, I have to, she checks that every month, because the lupus attacks the kidneys usually first, especially in SLE patients such as myself. So my kidneys are always being monitored to make sure that, they have what they supposed to have and they working at the level that they supposed to work at. I mean, I've had, to take weekly injections before. Methotrexate, that's the name of the drug. I used to have to go to the hospital, to the clinic at the hospital, every Thursday and get an injection of methotrexate. And I didn't like that. You know, I don't know if it really helped for the lupus because I was working real heavy at that time. And when I would go and get those injections on Thursday, I wouldn't start to feel good again until around about Monday and Tuesday. And then it's time to get ready to go do it again. And when I say feel good, I mean like, for one, I stayed with a nasty taste in my throat, you know. I would feel like I'm going to throw up every 5 minutes. I couldn't get my mojo together. I couldn't, you know, move around like I wanted to. I didn't have any aches or pains, but it was just a sick feeling that I would get every week. And I did that for 2 years. It was bad. And then finally, I got to my breaking point, and I told my doctor, I was like, you know what? I can't do this no damn more. And, so we ain't doing this shit, okay? And I guess I said it for a couple of weeks, and he was like, well, you know, asking me how I feel. I can't really explain to him how I feel. I don't know if the words escaped me, or I just didn't know how to formulate the words. I just didn't know how. I just kept telling him I don't feel good. I feel off. I feel like I'm gonna throw up every 5 minutes, and then it's the scent that stays in my nose of that damn injection, because that medicine got a scent to it, and that shit will stick to your damn nostrils, baby. But you know, it was bad. But I guess after a couple of weeks of me becoming so adamant about it, he finally realized that, you know, I might want to do something else. Because I'm telling you something about these lupus doctors, these rheumatologists. There are a lot of good ones out here, but it's a lot of piss poor ones out here. I mean, I have been accused of all kinds of shit, y'all, in just trying to get treated. You know, I told you sometimes you have chronic pain in your bones. Well, it used to get so bad at first when I first got my diagnosis. I'll tell you something. When I got the diagnosis and they told me exactly what it was, that's when it seemed like every damn thing went to going wrong that was supposed to go wrong with that shit, okay? It was bad, y'all. I'm telling you, it was terrible. I would go to the hospital with chronic pain. Now, my arms and shit would be like, man, now I got a, you know, I picked up weight because I have been on steroids. But my arms was like this goddamn big around, y'all. And I'm hurting. It just hurts to even fucking touch me. And I had doctors tell me before, shit like, you know, you just, you know, do you just want some pain medication? So you got to be careful and know your rights. Please know your rights, because if you don't know, you know what, I said this was going to be in the news, but this is just going to be my Lupus Awareness Month video, because this bitch is 17 minutes and I ain't through talking. So I'm going to do this, and then we're going to come back and do in the news the little shit I had to say about that, okay? Alright, so, you have, like I was saying, you got to know these doctors. You got to know, you got to pick the right one for you, for one. You got to have somebody that's willing to understand that this is a very complex disease. Now, you would say, yeah, he went to school, he ought to know. Now, these motherfuckers don't always know, because sometimes they come at you on the left and you just telling them the truth, you know. It takes time to go and research what this particular patient is having. And I just told you all at the beginning of the conversation here that the shit is different in everybody, okay? So, you know, make sure that if you got family members or you yourself have lupus, that you align yourself for one with a good support system. And make sure you know your doctor and he knows you. Because the shit is not going to stay the same. Every year it's a new something else that I have to deal with. You know, last year it was a lot of hair loss. This year, now it seems like my face want to start acting a damn fool again. It's always something new with lupus, and people don't realize how bad it is, because all lupus people don't be on a fucking disability and shouldn't have to, you know, right off. I'm one of them people, you know. It'll fool you, because people like me will be up to date, moving around, social, you know, no restraints whatsoever, just feeling fine, doing fine, and that's all day. By 8 o'clock that night, I could be laying in this damn bed, can't move, muscles and joints killing me, or I got a splitting damn migraine, and I don't know why, and I got to lay here and basically be in pain. And back to the hospital thing, a lot of times lupus people just stay at home and don't go to the doctor because these emergency rooms, I don't think they equipped to deal with people with chronic illnesses at times. And I'll say that because if I come in and I have a history of SLE, and I'm telling you what my issue is, I don't care if I was there 3 months ago with this same issue and you gave me X amount of pain medication to help me cope. I don't feel like I should have to explain that to you again about why I need this drug, because you already know. A lot of times, because they've gotten in so much trouble behind people, misusing prescription medication, namely pain pills and shit, it's hard to get help when you go to the emergency room with certain lupus related symptoms. So a lot of times, myself and I've heard other people say that they just try to deal with the pain, and it builds up your pain level, your intensity for your ability to take pain is what I'm trying to say. Okay, it get better. I have a high tolerance for pain. I didn't have that until my journey with lupus, because I got tired of being looked upon as possibly a drug user, or just people in the emergency room not being compassionate. I'm talking about the staff, being compassionate to what I'm going through. It's a lot dealing with lupus. And it is a game of Russian roulette we play every single day of our lives, because we don't know from hour to hour if we're going to be able to continue life, normally, or are we going to be put out the game because we got to lay down for a couple of hours or lay down for a couple of days. What I do is I keep moving. I keep active. Sometimes even through the pain, I still move around because I don't want to succumb to it. If you allow your body, especially as you age with it, you have to keep these bodies moving. Even though, I pick weight up, I drop weight. I pick weight up, I drop weight. I don't give a damn. I'm still going to keep active. I'm going to keep moving in some kind of way to keep blood flowing right to my heart, and to keep my bodies from beginning to, deteriorating shit because I'm not using them because they hurt. I keep fighting it and stuff. I'm always doing something to try to keep it moving, So that's what lupus basically is. It's hard. I ain't gonna lie. I've been here for a minute with it, but over 10 years survivor. But it's hard. It's really hard because people don't understand what exactly we go through. They don't understand that we want to do better. They don't understand that we don't want to be confined to a bed and be dependent on people to help us just to be able to do, the simple things in life, like maybe walk to the bathroom or take a shower. You don't want to be dependent on nobody to help you do that shit. But if your body is shutting down on you from time to time like that, and the level of pain that you be in sometimes, you don't want to live like that, but you can't help it. What you gonna do, die? I don't feel like that's where I'm. Hell no. If it's gonna take me out the game, I ain't gonna walk to the door to meet the shit. I ain't. Hell no. You gonna have to come get me, cause I'm gonna keep on striving. You just gotta be careful. That's all I can say. Be careful. Take care of yourselves. For those of you who may have it, those of you who may have family members that got it, please keep a constant check on yourself, because this shit is genetic too. Okay? Take care of yourself. I know we in the black community, we hate to go to a motherfucking doctor, and I was the main one, y'all. But now it's like doctors have become a normal for me. I know every month I'm gonna see my rheumatologist, because I go for monthly injections to control the lupus symptoms. All the medicines, all they basically doing is suppressing it, because there's no cure for it. So they try to make it as comfortable as possible living with it. And sometimes some of the medications, they don't always attack or help you deal with the pain aspect of it. It just stops other shit from kicking off that could cause you problems. That's why most lupus people eventually wind up with a pain management specialist that helps them, and that's kind of easier now, with how you get treated in these ERs and stuff for pain and stuff. They don't really want to do that because people done fucked it up for you. But that's basically it. I'm going to put in the link below some of the medications, because I think I told y'all about all of them. Yeah, I told y'all about childhood, neonatal. Yeah, okay. It's some drugs that people take too for high blood pressure. One is also for I think one is for acne treatments and stuff like that. I'm gonna put the meds in my description box. If you know anybody that's taking them or hear of these drugs being taken by anybody in the future that you may know, and they start having symptoms similar to what I discussed in this video, don't just automatically assume that they have lupus, because some of these drugs actually do cause lupus-like symptoms, and nowadays doctors are starting to use them less, but they still do use them. So I'm gonna put that down there, so that'll be a little information for y'all to put in your bank in case you know somebody, or later on, and as you live your life, you can run up on somebody that's going, taking these meds, and they think they having lupus-like symptoms based on what I'm telling y'all some of the symptoms are in this video. And it's not that, because there are some drugs that cause you to have lupus-like symptoms, and once you stop taking that shit, those symptoms go away. But the best way to know is to go be tested. That's the surefire way of finding it out. I'll never say don't go do that. If you got lupus traits in your family, of course, by all means, go when you go for your yearly checkup or whatever. Tell your doctor about that so that they can run the necessary tests. Because if they don't look for lupus, it'll hide for a very long time. So, I'm gonna do that. And most of my information, y'all, that I've learned over the years has been through personal experiences. Like I said, the Johns Hopkins Lupus Center. I'm in direct contact with them a whole lot about it because I want to know. And you can look stuff on the internet. It's a whole lot you can find out about lupus if you're just curious to know what it is, or if you really just, you're going through the struggle and you don't know what to do. Look on the internet, and if anybody know anybody that has questions, feel free to contact me. I always have my email link below. Hit me up on Twitter. Follow me. I'll follow you back at Epitome of Lady. And you can DM it to me. It can be very confidential. I don't put nobody's business out but my own. I'm candy bearers on this shit. I might tell my shit, but I can keep going. Okay? I think that's about all I wanted to say. As y'all see, I'm rocking the purple for Lupus Awareness Month. My sister had got me these. I wore them in one of my Real Housewives of Atlanta reads. But I really do love these earrings. They ain't, I don't know. I just like the different shades. But anyway, I appreciate y'all taking the time out to listen to me talk about lupus awareness, and giving you some information based on what I know from research and what I experienced. If you know anybody that's going through this, pass my video on to them. I'll also put the Lupus Foundation information inside of the description box if you want to contact them for, more information, support groups, donations, anything. If you want to partake in one of the walks that go on across the city, you can contact these people as well. In the meantime, in between time, guys, please like, comment, subscribe. I'll see you all on the next video, which will actually be in the news, because I did something totally different on this one. I don't know. This what you did. Okay, y'all keep watching, man. Keep on.